And joining us right now is Secretary of Veterans Affairs David Shulkin. Secretary, good to see you. Thanks so much for joining us.
Good morning, Maria.
Walk us through the change. Why is the electronic health record system so important, and why is this a big change in your view?
Well, like everywhere else in society, technology is becoming so important to the way that we manage all of our decisions, especially health care. And so we want to make sure that the veterans have the very best technology that's available, and modernizing our information technology is really at the top of our list.
So tell me about that and why veterans are going to see a difference. I mean, you know, when you first took the job, there was a lot of conversation about restoring credibility. I mean, you come with a fantastic resume in terms of health care, having run Beth Israel in New York. You've got a $177 billion budget this year. How do you allocate that money, and what are veterans going to see that is going to be different with these new health records?
Well, we're putting the veterans' needs first, and we're really redesigning this organization to make sure that it works for veterans. But I think in this decision in particular, what you're seeing is you're seeing two big parts of the federal government, the two biggest agencies, in fact, the Department of Defense and the Department of Veterans Affairs, working together unlike ways that they have before. So you're going to have a single medical record from the time that you enlist in the military all the way through really towards death. So it's a single way of caring for a patient, which in the past it's been two separate systems.
That's a big deal because it's organized and it makes sure that veterans have the information they need when they go to the doctor, when they actually need the care.
And it's a way for us to make sure that we're really addressing all of those needs, particularly at that time when you leave the military and before you enroll in the VA. That's been a transition time that's put people at risk.
I see. Now, in the State of the VA report released last week, you said that your agency is still in, quote, still in critical condition, despite efforts to cut wait times and appointments and also expand private care. What's at the top of your list now in terms of reforms?
Well, today we're looking at the Senate that is going to be voting on an accountability bill. And as Secretary, I need the authority to make sure that we have the right leadership in place. So that's really important. We're also looking at refining and improving our appeals process. Veterans are waiting too long to get decisions, and that's something else that we're looking for the Senate to take up in the very near future. And finally, we're looking to work with the entire Congress to make sure that we have a program that will allow veterans to get care in the VA, but when they need to get care outside in the private sector. And that's a piece of legislation that we're looking to get in by this summer. So
what's the average wait time, Secretary? I mean, I'm looking at a report right now that the review released said that 1,100 veterans in Phoenix still waiting 30 days or longer for appointments. This might be an old report, but the average wait time for a mental health appointment at the VA is 4.5 days. What do you want to get? What's the goal? What should a wait time be?
Here's our goal, and that is that veterans who have a clinically urgent problem, somebody who needs to be seen right away, will be seen right away, that there shouldn't be anybody waiting. For routine care, sometimes people may want to be seen, but it's okay if they're waiting a couple days for their care or even a couple weeks if it's routine or elective care. But our goal right now is to make sure that nobody is harmed during a wait. And of course, that was the problem that we faced in 2014. Today, we have same-day services in every one of our VA medical centers in primary care and mental health.
Are there any other major priorities in terms of this year's budget?
Well, we have to get our staffing back up. We have to make sure that our facilities are in the condition that we all want them to be for our veterans. And so we're looking at a top-to-bottom review to make sure that this is the best system available anywhere.
It's terrific to see you modernize the agency, Secretary. Thanks so much for joining us this morning.
Thank you, Maria.
We'll see you soon. Secretary Shulkin joining us there.